Hey everyone, today we're going to talk about something pretty incredible, the human shoulder. I know it might not sound like the most exciting topic, but trust me, it's an absolute masterpiece of engineering. Think about it. It lets us do everything from throwing a ball to reaching for something on the top shelf. But here's the thing. That amazing freedom of movement creates a huge problem. I mean, it is the most mobile joint in your entire body, by far. So what keeps it from just falling apart? How does it stay connected? That's the big puzzle we're going to piece together in this explainer. All right, so to figure this out, we've got to zoom out for a second. Before we even get into the nitty-gritty of the joint itself, we have to look at how your arm connects to your body in the first place. And that's where something called the pectoral girdle comes in. So what is the pectoral girdle? Well, you actually know it as your collarbone, that's the clavicle, and your shoulder blade, the scapula. This pair is basically the bridge that connects your arm to your torso. And the cool thing is, the whole setup is designed for movement. The collarbone and shoulder blade work together, and that teamwork is what gives your arm such an incredible range of motion. And this brings us right to the core problem, the big paradox of the shoulder. You have this joint that's built for unbelievable mobility, but it also has to be strong enough to handle everything we throw at it. How in the world does it do both? It's a real balancing act, for sure. This is probably the best analogy you'll ever hear for the shoulder. Think of it like a golf ball on a tee. Seriously, the ball is the top of your arm bone, the humerus, and the tee is the super shallow socket it rests in, which is called the glenoid. Right away you can see the issue, can't you? The ball is way bigger than the tee. That's great for movement, but it's also super unstable. So how does our body fix this wobbly situation? Okay, so part one of the solution is a really cool piece of anatomy called the glenoid labrum. The easiest way to picture it is as a little rubbery gasket, or a rim of cartilage, that sits right on the edge of that shallow T, the glenoid socket. And get this little rim makes a huge difference. Just by adding the labrum, the body deepens that socket by 50%. 50! It basically turns that flat little golf tee into a much deeper, more secure cup for the ball to sit in. So how does it do that? Well, it's got three main jobs. First, it's like a bumper guard, physically stopping the ball from slipping off the tee. Second, it's a shock absorber, which is super important when you're moving around. And third, and this is really cool, it creates a kind of suction cup effect. It helps maintain a negative pressure in the joint that literally sucks the ball into the socket and holds it there. Okay, so the labrum is amazing for what we'd call static stability, just holding things in place. But that's not enough, right? We need something that provides stability while we're moving. We need a dynamic system. And that, my friends, is the job of the legendary rotator cuff. So a lot of people think the rotator cuff is just one muscle, but it's not. It's actually a team of 4 muscles and their tendons. They all start on the shoulder blade, and they wrap around the top of the arm bone, creating this perfect cuff that hugs the ball and keeps it right in the center of the socket. All right, let's do a quick roll call for the team. You've got the supraspinatus, that one helps you lift your arm out to the side. Then you have the infraspinatus and the teres minor. They work as a pair to rotate your arm outwards. And finally, on the front side, you have the subscapularis, and its job is to rotate your arm inwards. Now, they each have their own role, but the real magic, the real secret sauce, is how they work together. Okay, this is where it all comes together. We've got the bones, we've got the labrum, we've got the muscles. Now let's see how they create this incredible harmony in motion. This is how the shoulder creates stability while it's moving. It's pretty amazing. So the big idea here is something called a force couple. And the horse reins analogy is perfect. Think about it. You pull the left rein, the horse turns left. You pull the right, it turns right. But what happens when you pull on both reins with equal balanced pressure? The horse's head stays perfectly straight and stable, right? Well, that's exactly what the rotator cuff muscles are doing to your shoulder joint. And here's a great look at that in action on the horizontal plane. You've got the subscapularis in the front pulling one way, and the infraspinatus in the back pulling the opposite way. Those rotational forces basically cancel each other out. But what's left? A pure, straight-line force that compresses the ball right into the center of the socket. It's genius. Okay, so that's side-to-side stability, but what about up and down? When you go to lift your arm, your big deltoid muscle, that main shoulder muscle, pulls straight up. If that's all that happened, the ball would just slam into the roof of the shoulder. Ouch. But the rotator cuff has another trick. The other muscles pull downward at the same time, perfectly canceling out that upward pull from the deltoid. This keeps the ball centered, allowing it to glide smoothly instead of jamming. This whole coordinated movement is so elegant, it actually has a name, scapulohumeral rhythm. It's not just your arm bone that moves. To get your arm all the way overhead, your shoulder blade has to move too. And it does it in this beautiful, precise ratio of 2 to 1. For every 2 degrees your arm moves up, your shoulder blade rotates up 1 degree. It's like a choreographed dance, and it's what lets you lift your arm all the way without everything getting pinched. Now, obviously, with a system this complex and this mobile, things can and do go wrong. So let's talk about what happens when that perfect harmony gets thrown off by an injury. Injuries to that labrum, the little bumper guard we talked about, are actually pretty common. You can tear it from a sudden trauma, like a fall, or from just doing the same overhead motion again and again, like in baseball or swimming. When that happens, you can get instability, where the shoulder just feels loose, like it might pop out. And of course, just like anything else, it can wear down over time with age. The good news, though, is that there's a really well-established path to getting better. It almost always starts with the simple stuff: rest, maybe some anti-inflammatories, and physical therapy to get that rotator cuff strong again. If that doesn't do the trick, doctors can go in with minimally invasive surgery to fix the damage. But here's the key: no matter what, rehab is everything. You have to retrain those muscles to get that beautiful harmony back. And you know what? The results are usually really, really good. The research is clear. Most people get their full shoulder function back after a repair, and a whole lot of them get back to playing the sports they love at the same level they were before. It's a fantastic success story, really. So when you think about it, the shoulder is so much more than a simple joint. It's this incredibly smart, dynamic system that's in a constant balancing act: mobility versus stability. It really is a masterpiece. And now that you get how it's all put together, you have the knowledge to help protect that amazing design for years to come.